My name is Roger Friedman. I'm one of 3 physicians who make up the Plastic Surgery Institute of Washington. Our practice is primarily cosmetic, although we do some reconstructive surgery as well. And really the purpose of this meeting is for us to share with you information about the procedures we do, what's required afterwards, so that it can be a really nice experience for you and for our patients when you're caring for them. All right. So in your packet, just to walk you through your packet, on the left side are our postoperative instructions. The most common procedures that you're going to be seeing are a tummy tuck, which is called an abdominoplasty, a breast reduction, liposuction, and then some facial procedures such as a facelift, which is often associated with eyelid surgery as well. So I'm going to talk about that as well. This is really a reference for you to, which is the same information that we provide for our patients. So therefore, what you're reading is the same thing that they see as part of their instructions. On the right side, depending on the procedure, specifically on a tummy tuck, people go home with a Foley catheter. This is information about the Foley catheter. And on the back, the second page is how to remove the Foley catheter. If you look at the picture on the front, in red identifies where the syringe port is. And the syringe or the balloon in the catheter holds 10 cc's of saline. So you would essentially hook a 10 cc syringe to that and draw out the 10 cc's of saline, which in turn collapses the balloon, and then it just slides right out. Okay. We typically remove catheters the morning after surgery. The purpose of sending people home with a catheter is to make their life easier that evening so they don't have to get out of bed. Okay. But the next morning, once they're out of bed, I don't want them to depend on the catheter. I want them walking around. Okay. And then there's a drain instruction sheet. And on the back side of the drain instruction sheet is the scorecard. And the scorecard essentially is where we keep track of what's coming out of the drains. So we ask our patients and ask you to empty our drains every shift or every 8 hours. Okay. All right. Our goal for removing a drain is 10 or less 2 times in a row. So therefore, it's identified morning, midday, and evening. To me, it's 8 in the morning, 3 in the afternoon, and bedtime. Okay. But on the front side, it talks about how to empty the drain. And then lastly, there's an instruction sheet on Lovenox. Often we'll send people who've had a tummy tuck home on Lovenox. So this is a shot. It's a blood thinner. And the purpose of that is when you have a person who's less active than normal, and when we tighten the muscles of the abdominal wall, it increases the intra-abdominal pressure and may predispose them to a blood clot. Oh. So we'll let them do Lovenox for the first 7 days until they're more ambulatory. In the instruction sheet, it typically describes shooting it into your abdomen, but if we've operated on your abdomen, what we'll have you do is alternate thighs. Okay. Okay? All right. While we're talking about it, let's talk about drains for a moment. So this is the type of drain that we use. It's called a Jackson-Pratt drain. All right? If it is not compressed, it is not working. So if the drain is sitting open like this, then it's getting the benefits of gravity drainage. It's worthless. You always want the drain to be compressed. So if, in fact, when a person comes to you shortly after surgery, they may have more drainage, it may fill up early, empty it and compress it. But don't sit there and say, well, wait a second, it's not time to empty it, and leave them with a full drain. You always want it on compression, on suction. Okay. If perchance the person is draining and it's 50, 50, 50, then it goes to 0, something's wrong. It should taper down. It should never be a sudden drop. And if it's a sudden drop, more commonly than not, they're leaking where the tube comes out through the skin. What it means is there's a clot in the tubing. All right, so it's coming out the easiest way, which is around the tubing. So then what we'll do is we'll ask you to milk the drain. So if this is where it leaves the skin, we'll ask you to pinch it there to compress it, strip it down to the bulb, and then you release both. And you may have to do it anywhere 5, 6, 10 times, and and you'll see a clot move down the tubing. And once the clot gets to the bulb, then all of a sudden the flow picks up. So it just reinforces there was a clot in your tubing.
Right.
Okay. So the take home is it should taper.
Okay.
All right. Now, let's just say on the other side, you have a person who gets to you and it's like, wow, 70 cc's. I just emptied it. Wow, it's filling up again. 70 cc's. I just emptied it. It's filling up again. Something's going on.
Okay.
Call us.
Okay.
All right. Always too easy if there's a question to call us. Don't ever say to me, didn't want to bother you. I want you to bother me.
Okay.
Okay.
All right.
So I'd rather know than not know.
Absolutely.
All right. So everything that I'm going to talk about should be covered in your handbook. Okay. So I'm going to take you on a little tour of some of the things that we do.
Okay.
All right. So more commonly than not, the people you're going to see are people who have nobody at home to take care of them or are having a larger procedure and they don't want to bother their family. So those are probably the two most common things you're going to see. I would think that it'd be very unusual for you to see a person who just had a breast augment. Okay. Not enough happening there. I'm sure they have a friend who can help them out. Okay. But a mommy makeover is what we call a procedure that has 3 components. It involves the abdominal area, usually some liposuction, and usually a breast procedure. So you're typically talking about a tummy tuck, liposuction of the flanks and back, and either a breast lift, breast reduction, but something breast related.
Okay.
So those 3 procedures make up what's called a mommy makeover. So when you see those patients, they will have a catheter, they will have a drain. All right, so you're getting it all in one person. From leaving here, getting in the car, getting into your facility, I'm exhausted. Great. You may not be able to get them right into bed. Pit stop them into a chair, put their feet up on the coffee table, let them take a break.
Okay.
They may even fall asleep. Fine. They wake up a little bit later. I think I'd like some soup or something to drink. Great, let's help me get into bed. So when you get them into bed, then you essentially want to get them into like a beach chair type position.
Okay.
So if the bed is controlling, that's great. If not, I put pillows behind their back, pillows under their legs to make them into a beach chair type position.
Okay.
I instruct all the patients to do 2 things first. First of which is foot exercises. That
Like
exercises your calf muscles.
Mm-hmm.
So it's like going for a walk. It helps to minimize your chances of blood clots. Second thing, when you've had a tummy tuck, it's hard to take a deep breath. It's important for us that you take a deep breath. The deep breath fully expands your lungs, minimizes your chances of getting atelectasis, which is a collapse of the peripheral airways, or pneumonia.
Mm-hmm.
So easiest way to do that is take a folded towel, hold it against your abdomen to give you support, and then you're taking your deep breath. 1, 2, 3. All right. If they do this, it does nothing for me. You want a sustained deep breath to fully expand your lungs. So I tell them to do each of these exercises, the foot and the breathing, 10 times an hour while they're awake. All right. It helps to keep them out of trouble. All right. So now it's the next morning and you want to get them out of bed. They should roll onto their side and push off because now they're using arm muscles to sit up, not abdominal muscles.
Okay.
What I tell people is the easiest way to remember that is pretend like you're pregnant. All right.
Yeah.
You can't get up like this.
No, that's true.
Right.
You have to.
So therefore, they're not using their abdominal muscles. It's easier to do. When they get up for the first time, let them sit on the side of the bed for a second. Let them equilibrate. Because often if you've been laying down for a long time and you sit up too quickly, you get lightheaded. All right. So if a person says they're lightheaded, first thing I do, check their pulse. If my pulse is steady, you're lightheaded. All right. And if it doesn't come back to a nice bump, 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 I'm going to lie you back down and let you wait a little bit and try again a little bit later. But if they say they're dizzy, more than likely you're not going to get a good pulse. You need to lie them down. It lets blood flow go back to their head.
Okay.
All right. Now, I'm sitting on the side of the bed. I feel good. Great. Stand up by the side of the bed. How are you feeling? I'm good. Great. Let's walk to the bathroom. Okay. Or let's walk to where we're going to take you. All right. But everything is in slow motion. You're in no rush to get anywhere because if you rush, they're going to end up on the floor. All right. Just going to make more work for you. All right. So everything is in slow motion. And if at any point they get lightheaded or dizzy, go to the preceding step. Okay. The day after surgery, they're sitting in a chair. Do we have the availability of like a recliner or just regular chair in the room? What's in the room?
I think it just depends on
So
the room.
it might be nice for people who've had a tummy tuck to have a recliner.
Absolutely.
All right. Because then, you don't want them, if they're sitting in bed, number one, it's harder to breathe. They're not going to get out of bed. They're not motivated. If they're in a recliner, you can get them up, get them walking around much more easily. So that's what I would propose if it's available. Okay. All right. Questions so far on mommy makeover stuff?
Yes, I did have a quick question. So when you're talking about, after the procedure and they're home and you elevate their legs, how long per se would you like us to keep their legs elevated?
Whenever they're down, their legs are up.
Okay.
I mean, they're not going to be with you that long.
Right.
The most they're going to be with you is, I guess, a couple of days.
Mm-hmm.
So while they're with you, their feet should be up.
Okay.
Because what's going to happen if they don't, they're going to get swelling in their ankles. So the answer is you want your feet up.
Okay.
Okay. All right. So swelling goes down with gravity. So if my legs are dependent, they're going to swell.
Okay.
If I happen to do an arm procedure on you, if your hands are where we normally keep them, they're going to swell. So if I'm doing an arm procedure called a brachioplasty, I will have them put a couple of pillows on their lap, and I say it's like you're reading a book.
Oh, yeah.
Your hands are higher than your elbow. Swelling can't go uphill. It's going to linger around their elbow because there's no way to get rid of that, but it can't go uphill, and their hands aren't going to swell. All right. Questions so far?
What about their medication?
Great. So I would then resume their medications the way they normally take them.
Okay.
All right. The only thing that we don't let them take are aspirin or Advil, any of those anti-inflammatory products, because they make you bruise or bleed more easily.
Okay.
Otherwise, we'll let them take their blood pressure medicine, which I think is important. Any kind of, if they want vitamins, not a deal breaker to me. But to me, the blood pressure medicine is probably more important. Their thyroid medication. Many people today are on antidepressants. I'd let them take those.
Absolutely.
So back to taking their normal meds.
Diabetic.
All right, so diabetic, that's a whole different story.
Okay.
So if it's an insulin-dependent diabetic, then most of those people today can check their own sugars. They often have on their arm that they can check their own sugar. So obviously, you're going to check their sugars periodically and treat that. All right. More commonly than not, we're seeing people who might be like on metformin.
Yeah.
Oh,
So
that's
therefore,
common.
we don't even check their sugars when they're on metformin. Okay. So,
Okay.
All right.
and then you can ask them questions about what they normally eat.
Okay.
Yeah. Because I'm not trying to change things. I'm trying to get back to your routine. Okay. All right. Let me make sure I got everything I wanted to ask. Good. All right. So the next thing I want to talk about is facial procedure. Well, I'm sorry, before I go there, let's talk about liposuction for a minute.
Okay.
So you're not going to see a limited liposuction. You'll see somebody who's had a lot of liposuction, meaning multiple areas, maybe their abdomen, their back, their legs. So again, anything on the legs should be elevated, right? We do close our liposuction sites. They're usually 1/4-inch incisions, but in spite of that, they will drain, okay, in the first 24 hours. So what we suggest is put a chucks on the bed and let them drain onto the chucks, change the chucks. As opposed to drain into the bed, now you have to change the whole bed.
Exactly.
When I do lower extremity, initially what I put them in a dressing is pantyhose with ABD pads.
Okay.
All right? Because they're going to leak into the dressing is going to get dirty. Then they come in 2 days, get them out of all that. We actually put them into a compression garment. But I personally don't put compression garments on you the day of surgery because you're going to leak into them. They're going to get bloody. And then I'm going to say to you, I want you to wear it for the next month. And you're going to say, I can't wear this. It's filthy.
Yeah.
All right. So again, and for the abdominal area, it's usually a soft binder. If we're doing the upper back, I usually wrap them with ACE bandages.
Okay.
But there's padding under everything. But where they're leaking, more than likely, they're leaking from a site that we suctioned. Recently, I had a person call me. They were leaking from up here. I said, I think what's happened is the dressing has slid down. The pad that was covering it is no longer there. If you can pull the pad up a little bit, that'll be more absorbent. But you're going to leak for 24 hours. Don't be alarmed. Okay?
But we are not obligated. We are not supposed to touch any bandage.
You don't want to take my dressings off because you're not going to be able to put it on the way I put it on.
Okay. Right.
All right? Now, let's say you call me about that. I may say to you, you may say, listen, I've got this wet ABD pad behind her left axilla. It's soaking wet. What should I do? I'm going to say, you know what? Take it out. Take a new ABD and just slide it in.
Okay. Nothing.
Yeah, no big deal.
Right.
But you don't want to take down my dressing because you don't know how I put it on. And then it's going to be a juggling act to try to put it back on the same way because patient's not going to be helpful. So ideally you want to leave the dressing. If they have a soft binder, the problem with soft binders is they start to ride up. So when you have them standing up, it's a perfect opportunity
pull it.
To pull them
Adjust
down.
it.
Yeah.
Okay.
But they will have a tendency to ride up.
Okay.
Okay. All right. Okay. Questions on liposuction? And otherwise, I'm moving on.
Keep moving on.
All right. So, face and eyes. All right. So when you get to these people, they're in a bulky dressing, most of which is cotton padding. It is intentionally bulky to get in their way. So it limits their neck motion, but it also provides gentle pressure to minimize swelling and bruising. More commonly than not, when I do a facelift, I do your eyes. All right. And the reason I do that is because when I'm doing a facial procedure, I'm actually pulling things back this way, but I'm also pulling things vertically, which contributes more skin to your lower lids. So I take out that extra skin. So if you've had an eyelid procedure, I'm going to have you put cold compresses on your eyes.
Cool.
The easiest way to do that is to take a 4x4, soak it in ice cubes and ice water, but open it up, fold it in half. Now one will go across both eyes.
Oh, okay.
If you put one on each eye, then what happens is I turn my head, it goes flying.
I had that before.
And you're constantly looking for the gauze patch and saying, right, because if you put one across both, it'll stay on.
It'll stay.
They all will go home with a tube of Lacrolube ointment. All right. You want to put that in their eye at night. All right. More commonly than not, it may be lower lids without uppers. So when you put the ointment in, you can lift up the upper lid to put a bead of ointment in. You don't want to ever pull down on the lower lid. Okay. If a person is complaining of eye pain, what you want to ask them is it eyelid or eyeball?
Okay.
My eyeball is killing me. I can't open my eye. I'm in so much pain. They probably have a corneal abrasion, which is a scratch of their cornea. It hurts like hell. All right. And the only treatment for it is close your eye. Leave it closed. If you open and close your eyes, it's like somebody's rubbing sandpaper in your eye.
Oh,
It's exquisitely painful.
sounds
So if they'll let you, put some ointment in. If they don't fight it, but just say, listen, close your eye, keep it closed, put a cold compress on it. By tomorrow morning, it'll be 80% better. The eyelid resurfaces itself over a period of about 24 hours. So they're dramatically better by morning. But what they really need to do is keep their eye closed. All right. And if there's a question, again, reason to call us. Okay. We like to put those people on a wedge pillow, okay, as opposed to two pillows. In other words, when you sleep with two pillows, which most of us do, it flexes your head on your neck. It creates tension behind your ear. That's the area that's most tight normally after a facelift. That's what you're trying to avoid.
Okay.
If you put them on a wedge, your head and your neck are on the same plane. You don't have that flexion. If you want to be higher than the wedge, that's fine. I'm going to put the pillow under the wedge.
under the wedge. Okay.
When you're lying on your back, it is more comfortable to put a couple of pillows under your knees. It takes the tension off your lower back, and it also helps to minimize you sliding in bed. So that's what I typically do to get them comfortable.
Okay.
The two most common complaints on a facelift: I am sore around my ear. Of course you are. That's where your incision is.
Mm-hmm.
I'm going to give you a pain pill.
Okay.
I feel tight in my cheeks and neck. I've tightened those muscles. Take a muscle relaxant.
Okay.
I'm not sure what I'm feeling. Fine. I wouldn't hesitate to give them a muscle relaxant and a pain pill at the same time.
Okay.
Okay.
So that doesn't.
What's the worst scenario? They fall asleep. It's a good scenario.
Yeah.
All right. But then often what'll happen is the next time when they wake up, they go, you know what? I get it. Right now I'm just sore around my ear. That was tightness. I understand the difference. I just need a pain pill.
Okay.
All right. Now, if you feel that you're not catching up to them, call us.
Okay.
Because what I may say is you're doing all the right things. We're behind.
Okay.
Give them an extra pain pill. Give them another muscle relaxant. But the goal is to get them comfortable. So I'm not so rigid about how often they get it. Because there are times when I might just say, listen, you need another pill. Let me just give you another one.
Okay.
And they're more comfortable. Okay. Facelift patient. My right cheek is killing me. They should feel the same.
Right. On both sides.
Something's wrong.
Okay.
All right. So therefore, what I then do is I would take a couple of fingers and I would slide under my dressing. Feel the right side, feel the left side. All right. Your cheek should feel like your thenar eminence, spongy.
Okay.
If it feels like a fist, it's a hematoma until proven otherwise. Okay. And again, you have one side to compare to the other. The odds of having bleeding on both sides at the same time, unusual. So if one's soft and one's hard, something's going on. My dressing feels too tight. If you slide your hand under my dressing, it's all cotton. It's not tight. The tightness you're feeling is I tightened your muscles. That's what you're feeling. You need a muscle relaxant. Now, if I reach under your dressing though, and again, this is really hard relative to this, which is really soft, I'm concerned that you have some bleeding. Okay. Bleeding is typically associated with severe pain. Reason to call us. Okay. So the real issue is if there's ever a question, it's way too easy to call us. Okay. I can say, listen, thanks for the call, but actually, I think everything's okay. Or let's try this. If that doesn't work, call me back. Okay. But that's the easiest way to do it. Okay. But those are probably the three most. So the hematoma is my worry. Eye pain is my worry. And then really differentiating soreness versus tightness, which also applies to abdominal procedures.
As well.
If I tighten your muscles, is it a tightness or pressure, or is it pain? I feel like you're sitting on me. Muscle relaxant. It's really my incision. It really hurts. Pain pill.
Pain pill.
Okay? Questions. But those are the most common things you're going to see.
Okay.
All right. So, again, the instruction sheets you have,
It's a point of reference.
exactly, but you'll know that that's what they were given as well.
Okay.
Okay? And hopefully they've read that before they come to you. So, in preparation for their procedure. Okay? We also send our facial people home with a combination arnica bromelain, which helps to minimize bruising and swelling. They can resume that after the surgery as well. But to me, anybody's had surgery, we start them on clear liquids first: water, apple juice, tea, Gatorade,
Broth.
Broth.
chicken broth.
Really cute article years ago analyzing chicken noodle soup. You're saying your mother was right. It's fluid, it's electrolytes, it's protein. So they may just do the broth plus some noodles, broth plus some noodles plus some chicken. Okay. Milk products, ice cream, yogurt, acidic products, orange juice, harder to digest, wait 24 hours.
Okay.
Okay.
All
Good.
right.
I think that's it. But if questions come up along the way, way too easy to call. Okay. I would always rather you call us than say, listen, I didn't want to bother you,
That's right.
because you might miss something that I would have caught. Okay.
As my grandfather says, better safe than sorry.
Absolutely. Totally agree.
Absolutely.
Good. Okay.